friends. So this is your final rapid revision before your INI-CET exam. If you have not watched the new drug update part 1, 2, 3, 4, 5, then watch it, and the link for this part 1, 2, 3, 4, 5 is in the description, so you can watch it easily before your exam. If you are coming to this channel for the first time, then subscribe my channel for more pharmacology related updates. So let us begin the new drug updates. Factor 11 inhibitors. So factor 11 inhibitors, it inhibits the factor 11, which is the part of the intrinsic pathway. And advantage of these drug are it prevents the pathological thrombosis, but at the same time it decreases the bleeding risk, and it does not affect the normal hemostasis. So normal hemostasis will stop the bleeding. So that pathway is not affected. So these drugs have lower bleeding risk as compared to the traditional anticoagulant. So this statement can be asked in the exam directly in the form of MCQ, how the factor 11 inhibitors differs from the traditional anticoagulants. So this is very important. Now factor 11 inhibitors oral drugs include asundexian and milvexian. In its spelling, you can see XIAN. So that stands for factor 11 antagonist. Factor 11 inhibitors, which are the monoclonal antibodies, and these are the parenteral drugs. The name of the drug are abelacimab. Now here EL stands for 11 inhibitors. So that way you can remember that this is a factor 11 inhibitor. Osocimab. So CI in its spelling stands for circulation. That means this is the parenteral drug and it is a factor 11 inhibitor. And Gisomab. So XI again in its spelling, that stands for the factor 11 inhibitor. So XI in its spelling, that stands for factor 11 inhibitor. So these are the parenteral drugs, and which are the monoclonal antibodies. So these drugs have lower bleeding risk as compared to the traditional anticoagulant. So this statement can be asked in the exam directly in the form of MCQ, how the factor 11 inhibitors differs from the traditional anticoagulants. So this is very important. So if you like the video about the factor 11 inhibitors, then subscribe my channel, and before your exam, at least one more time you revise this whole series of newer drugs from part 1 to part 6 for your better retention, and that will have a potential to boost your rank higher. So thank you for watching the video.